emergencies. We're all sort of the policymakers for our either executive agency or our branch of government. So I appreciate the commitment. And it really is impressive seeing the large amount of work being done. The legislature last session did that youth oversight committee, and Justice David is chairing it. I went to the first meeting, and what a powerful group of people coming together with regard to kids that are in the detention system and saying we've got to do better, looking at the data. And then they've got dozens. They set up the model for that exactly as this model was set up with regard to getting content experts to do it. So we will be getting some good, some great information from that. And I really look at seeing some uniformity with regard to, you know, if you're arrested in one county on the charge, this is a child, you're detained, but in another county, you're not. So I think some great outcomes are going to come from this. So again, I think we hit a home run getting him in the middle of his retirement to agree to chair that committee. And I know some of you are on it, so I appreciate that. So we have a consent agenda. We have the minutes from the June meeting. They've been provided. Any changes to that? And that's the only thing on the consent agenda, correct, Julie? So is there a motion to approve the minutes from the June meeting? All right, second. If there's no further discussion, all those in favor say aye. Aye. Any opposed? Great. Next, we have the annual report, and Zach will be discussing that.
Good morning. You guys hear me okay?
Yes.
My name is Zach Rosowski. I work for the Indiana Prosecuting Attorneys Council as the Public Information Officer. I'm also proud to serve as the co-chair of the Communications Committee for this commission. Before you have the annual report, and we are just asking for you guys to formally approve that. I'm happy to attempt to answer any questions, but full credit for the report goes to Julie for compiling all the information, and Lindsay at Court Services for doing the design work. We also got some great pictures from the Department of Education employee who came to a couple of the meetings to take some photos. So it's a great looking product, and I will attempt to answer any questions if you guys have any.
Any questions on the report? And Zach, thank you for your being on the communications committee. And it's really been effective to have all our public information officers from all our different agencies and branches work together in the communication element. It really has done a nice job on pushing the information about the commission out. So thank you, Zach, and please thank your committee on behalf of the commission. Is there a motion to approve the annual report? So moved. All right. Any other discussion? If there's no further discussion, all those in favor say aye.
Aye.
Any opposed? Great, thank you. The next item is under the strategic priority, juvenile justice and cross-system youth. We have Steve Balco and Nancy Weaver presenting on evidence-based programs for reducing and preventing violence. And there's an action items, a recommendation to endorse 3 of the violent prevention program models. Mr. Balco.
Good morning, and thank you for allowing me to be here today and present on this. I wanted too far.
There you go.
I just wanted to say we sat down and we looked at how we could identify and encourage those adoption of effective or promising practices on preventing or reducing the delinquent behavior. I'm here today with Nancy Weaver. We had one co-chair who retired in the middle of our committee work, and then another who became ill and was unable to complete the work. But so Nancy is here today helping me. First, we're going to look through the data a little bit, show what we're seeing in Indiana, what we're able to find, a little bit of the pitfalls, and then some of the programs that we reviewed, walk through what that process looked like. So to cover the data, I'm actually going to turn it over to Nancy, and she will cover that first part.
Thank you, Steve, and good morning. This work was undertaken as part of the Juvenile Justice and Cross-System Youth Task Force. And that task force, as you know, has several objectives. And so we broke up into subcommittees. And one of the subcommittees, the goal of that subcommittee or the task was to identify and encourage adoption of effective and promising practices for preventing serious and violent delinquent behavior. So the first thing that we did as a group, as a subcommittee, was to define serious and violent delinquent behavior. And just before the meeting started, I passed out a handout which went through how we define that for our work in this subcommittee. The other thing that I want to make note of is that although there were a couple of offenses of charges that did not qualify to meet this particular definition, we're very interested in it, primarily because of the reports that we were hearing around the increase in gun violence. And so we also included carrying a handgun without a license and dangerous possession of a firearm as part of this definition. The reason it did not was not included in the definition itself is because what we know to be true from our work in local sites is that youth often carry firearms. I shouldn't say often, they carry firearms, and there is also use of firearms in the commission of an offense, right? And so we wanted to make sure that we were parsing that out, because what we hear from youth is the reason that they carry firearms is primarily because they don't feel safe. And that requires a different response than if they are using a firearm or some kind of weapon in offense. Does that make sense? Okay, so just to be clear about why we did include that in our data collection, but wanted to be sure that we were looking at these behaviors and these delinquent acts, and we could parse them out separately. So what we did, we had Christine Reynolds, who was part of our subcommittee, and she's with the Indiana Criminal Justice Institute. Oops, that's going there. Oh, sorry. This clicker's a little funny today. Christine Reynolds from the Indiana Criminal Justice Institute did a data request to the Office of Court Technology to specifically get data on using these parameters. And we got data from 2011 through 2020. And we defined these by that definition of those acts as acts that had been filed in a petition to a judge delinquency or found true by adjudication or conviction. So that would also include youth who were 16 or 17 and may have been direct filed in the adult system for offenses like carrying a handgun without a license. Okay, so we're talking about youth who stayed in the juvenile justice system and also some of those youth who were processed in the adult system. And we requested data on all of the offenses that were either filed in a petition to a judge delinquency or found true by that petition in the juvenile court or by conviction. I'm going to pause just for a second to see if there are any questions about what we were asking. Yes.
So you got to be 21 to get a license, and we passed a law now that you don't need a license to carry. So I guess I'm a little confused on why you're doing that.
Prior to that most recent legislation, carrying a handgun without a license was a direct file offense. So you used
to be 21 to get that license.
Currently, but before it used to be 18. So at the time, like back in 2011, 12, 13, there were youth who were 16 or 17 and through 16 and 17 who, if they were charged with that offense, that was a direct file offense and they were automatically processed in the adult system. You're right, there have been some legislative changes to correct some of that, but we included those as part of our data set. Does that make sense? Kind of? Changes in legislation throughout. So we have a data set from 2011 to 2020. And so there will be changes in the in legislation during that time. Any other questions before I go forward? Thank you for that, Representative Hunt. Okay, so one thing that we learned almost right away is that we need to be cautious about drawing any conclusions from this because the data is likely incomplete. So if you look on the slide that has the map, you can see that there are several counties that indicated that from the data that we received from the Office of Court Technology, that between 2010 or 2011 and 2020, they didn't have any of these offenses, either filed as petitions or adjudicated or convicted.
Nancy, I'm sorry, what is the color?
The colors are more like a heat map. So red is a larger amount than the green.
And so the white means that there was no
No
numbers
data.
or no data.
Yes.
Which one?
No data. No data received.
But now with Odyssey, that could be pulled up. That was before we had the case management system.
This was using Odyssey, but you'll see in a couple of slides, I'll get to how there was an increase. I'll get to that in just a second. You're way ahead of me, but I love it.
Okay, all right.
We did pull this from Odyssey and SRS. The other thing to note is there was even one county where we noticed Lake County, they only had 19 cases total. And we were like, is that correct? And so we went directly to that county and said, hey, this is what we got when we pulled this. Is this right? And they said, no, it's not. We had more. So caution about that. But the upside is that we're really hopeful with the work being done under House Enrolled Act 1359 and the data plan that is being developed under that we will have much more confidence going forward when we pull this kind of data. The other thing we did, we went to a couple of counties. I think Wayne might have been one of them that we actually checked on also. And they said, no, this does not appear to be correct. The other thing that Christine helped us do was, even if we included or like did some kind of inference about what these additional counties might include, it didn't really change the story. So just want to be clear about that. So what we were able to determine from the data that we did grab, we had 2008 total acts that were included in that definition. And that was for 1,598 individual persons. Okay, so of that, you can see on this data, race and ethnicity slide that the primary youth who were included in that data set for having been petitioned or found true through adjudication or conviction, that they were Black, non-Hispanic. Second highest population was white, 656 individual white youth. Okay, so that's what that data shows. I can give you additional numbers if that would be helpful, but this just kind of shows in terms of the numbers.
I'm sorry, can you explain that one more time? What is, so the over here on the right, under ethnicity, you have non-Hispanic, so that's Black, and that's telling me that out of the 2008 total acts that you all tracked and the 1,098 individuals, whatever, you don't have a percent, do you have a percentage here?
So there were 1,598 youth.
1,598,
Total youth.
okay.
And we track race and ethnicity differently. So the first question that you typically ask someone to identify is, are you Hispanic or not? And then let them self-identify that as well as their race.
So what is this tell? This is telling me that there are a number of, the majority of Blacks that you tracked were committing the acts that you were tracking.
Of the 1,598 youth who either were petitioned or found true through adjudication or conviction,
I got that.
of 2008 offenses, of those 1,598 youth, 849 were Black, 825 identified as non-Hispanic.
Oh. Okay.
But again, and she's not, and I don't want to say, understand, this is a sampling. We did not
Yes.
have good data then. We have better data now and data categories. So this is a sampling. It's of data, but those numbers are correct based on the sampling that they had.
Thank you, Chief Justice. Yes. We decided to go ahead with what we had, knowing that we had some gaps in this data and also some questions about the quality, but it's what we had. And again, really hopeful that House Enrolled Act 1359 developing the data plan is going to help us going forward with this. So the next piece was by year, and you can't really see it on the slide. I'm hoping you can see it in your packet. Again, there were 2008 total acts, 1,598 persons. You can see in 2020, there were 150 acts that met this definition of either having been petitioned or found true through adjudication or conviction. The year before, 2019, there were 314. That's what that slide is telling you in terms of the individual acts. The next.
But again, I hate to say this, but it doesn't mean violence went down that year. It meant that the sampling and the way the information was collected. And then one of the reasons that the legislature is working with the judiciary is we've got to get better data. So this is, again, you can't say anything by the 150 versus, 2020 versus that. I don't necessarily know if violent crime went down. I think judges report there was less during that first intensive COVID year.
Yes, thank you. That's a question. So in the JDAI world, we say data is designed to elicit questions. And that's one question that our group had. There was it appears to have been a downturn in acts that met that definition. The other possibility, so it could be COVID related, right? The other possibility is that when Christine had the data sample pulled from the Office of Court Technology, that some of those cases had not processed through all the way to conviction or adjudication. So that would be the date or the year during which they met that definition. So it's very possible that if we did another one, there might be more numbers in 2020 right now because we're now in 2022 and this was pulled in during 2021. A little more explanation about why the data might look how it is. We don't quite know yet, but maybe. The next slide is another breakdown by age and gender. And what you can see by that, the primary highlight there is that the largest group of youth who met this definition were males 16 and 17 years old. And this does include those dangerous possession of a firearm and carrying a handgun without license, which again were automatically filed into the adult system. So that is not surprising since we did include those particular offenses. The next slide is a kind of a heat map distribution again. And what that shows is that in terms of those offenses that were included in the definition of serious and violent delinquent behavior, armed robbery was the #1 offense for which youth were petitioned in juvenile court and or found true for adjudication or conviction. That was a 486 number. The second one was dangerous possession of a firearm, 338 cases. Third, carrying a handgun without license. So again, you can see why we wanted to include those, because if we didn't have those numbers, I think the data here would look a lot different. Robbery, 132. Robbery resulting in injury, 123. Criminal recklessness, 107. And battery with injury at 93. And then there are the other offenses included that were lower numbers than that. But this gives us an idea. This is where we were working with Christine to say, if we had better data, would it change the story? And she did a little bit of inference and said, not so much, that the armed robbery is probably going to be, the armed robbery and the dangerous possession of a firearm and carrying a handgun without a license are the 3 primary offenses that we want to target when we did talk about interventions. Yes?
What's the number of armed robberies?
486. And I'm sorry, I got these slides from Christine. I wasn't able to manipulate them in a way to show some of this additional questions, so I just put it in the notes. Did you want any other of those numbers? Or?
Well, yeah, you can go through all of them.
Okay, sure. So armed robbery in the upper left-hand corner, the red box, 486. Dangerous possession of a firearm, 338. Carrying a handgun without license, 191. Just below that, robbery, 132. Robbery resulting in injury, 123. Criminal recklessness with deadly weapon, 107. Battery with injury, 93. And then the rest of the offenses were less than that. I didn't get specific numbers for that. I can certainly make that inquiry if anybody's interested in all of the acts. So that concludes the data piece. That is what we had to work with when we started attempting to meet our objective of identifying what would be interventions, promising practices to address this particular group of offenses and youth who are committing those offenses. And so I'm going to turn it back over to Steve unless anyone has questions for me. He's going to talk through the programs that our group identified as ones that we thought were evidence-based and or appropriate for Indiana to consider. Thank you.
Nancy?
Yes.
Just one question, just want to clarify. So
Yes.
you did say with the gaps in the data, you still think that the information you have is reliable enough to move forward with for probable interventions?
Yes, we didn't, the inferences that our partners at CJI were able to make, Christine felt strongly that it didn't change the story, the overall story, high level story, certainly. Thank you.
Thank you.
We have a new member here today. Were you here the last meeting? Because I was not.
No.
Okay, can you introduce yourself?
Sure. I'm Representative Carolyn Jackson. I represent the First District, Hammond and White.
Welcome. We're glad to have you. Do we want to all just introduce ourselves quickly since we have someone new? All right.
This is the first time I've ever been on time.
Yeah. And let's all just give, Senator Bro a round of applause for being on time. Julie?
Well, she was coming from Hammond.
And I come from Lafayette. 65 is no peach
No,
right
it's
now.
not.
Not no peach. I appreciate that.
Representative Jackson knows me. I'm Julie Whitman. I'm the executive director.
Hello, great to have you. Katie Jenner, Secretary of Education.
Good morning, Corey George, Chief Probation Officer in Wayne County.
Hi, Chris Naylor, Executive Director with the Prosecuting Attorneys Council.
Morning, I'm Chris Fox. I'm the Indiana Department of Health Commission.
Hi, Zach Jackson, the State Budget Director.
Justin Faulkner, I'm the Chief Administrative Officer for the Indiana Supreme Court.
Hi, Representative Vanessa Summers, South District.
Good morning, good to see you. Terry Stigdon, Department of Child Services.
Gail Devon, State Rep, St. Joe County.
Loretta Rush, Chief Justice, and we also have this guide for you in the packet. A lot of names.
John Hammond, Governor's Office. Good to see you.
Bernice Corley, Executive Director. Good morning, I'm Chris Schlesinger, Executive Director, Deputy Commissioner for Reentry and Youth Services for the Department of Correction.
Dan Ursiniak, Secretary of SSA.
Gene Bros, State Senator, Marion County, Indianapolis.
Jay Chaudhary, Director of the Division of Mental Health and Addiction.
I'm Stephanie Knight. I'm one of the youth members.
Thank you all. Sorry to take your time, but
There'll be a test later on.
You'll help me. Open book.
thank you, Mr. Buckley. You may proceed.
Thank you. So based on that data, primarily looking at the offenses and the ages of those involved in those offenses, what we really wanted to do was take a wide look at evidence-based, evidence-informed, promising practices on prevention and intervention programs. We had started with evaluating about 20 programs that were in effect in cities and locations across the state, really taking a look at the public health model of the interventions and how those programs will work. What we had done in evaluating those was really looking for the evidence base or that promising practice and distilled those down to 3 programs. The reason that we had chose 3 rather than just one, recognizing that not every community has the same resources, has the same needs, and is facing the same violence issues. And so we wanted to put these 3 out here because they look at the problem from different lenses. And so we will take a little bit of a walk through what each of those are. First, and I won't read the entire slide to you, is the Cure Violence model. This model is really in Chicago primarily, but it has spread out throughout the country at this point. And so it is an effective intervention, and it has been shown to decline in actual and attempted shootings in 4 of their 7 sites. And those ranged from 17 to 24%. The shooting hotspots declined in 6 of the 7. And then also the proportion of killings attributable to gangs was also decreased, as well as the retaliatory killings as well. Looking at this program, based on the analysis of those 10 years in Chicago, the efforts had saved was it $33? I can't read my slide anymore. $33 for every $1 spent and the savings as well. On the next page, we'll talk a little bit about how that, next slide, a little bit how that program works. And so that you can see where the behavioral changes and the norm changes occur, the steps that they take through ultimately ending up in those outcomes and the safer and healthier communities with that cure violence model.
I can't read them on my printout. I can't read them up there. I don't know if you have got a copy, you
I
can read
can't read.
those.
I didn't have my glasses on. Nope.
If anybody has a laptop, I did post the PowerPoint online, and so you may be able to get a better magnification if you pull it up from the website.
You want to just go through like activities? I think maybe you just need to go down and read those for us.
The activities.
Yes, activities, and then what is it? Intermediate outcomes and then outcomes.
Yeah, and so what I can do is I can start with the top half, the behavior changes, and then we'll tackle the bottom half with the norm changes as well. So for the activities and the behavior changes, outreach with the cure violence participants, street mediation and violence interruption, hospital interventions, and then group meetings with high-risk youth. And then those would lead to the intermediate outcomes. So for the outreach with the cure violence participants, intermediate outcomes include that the cure violence participants gain access to education and training, the participants gain access to employment, as well as the participants form boards and other bonds and other relationships that would help guide that. Further leading to the participants avoid situations involving the risk of violence, leading to the violence declines and fewer shootings and homicides. Working down to the next behavior change includes the street mediation and interruption. Again, the bonds and relationships, participants and other high-risk youth learn nonviolent conflict skills, as well as participants and other high-risk youth embrace nonviolent goals and values, leading to high-risk youth applying nonviolent approaches to conflict resolution. And again, the decline of violence, the outcome following that. And then the other two behavior changes follow the same that we had just discussed with the hospital interventions, as well as the group meetings with high-risk youth. Moving down to the norm changes, the green boxes there at the bottom, includes the activities include community outreach and focus groups, public messaging and education campaigns, attending the post-shooting responses, vigils, rallies, and marches, as well as coordination with faith-based and other community groups, and positive relationships with law enforcement and political leaders. Those first three are directly tied to, and then they all work together in the next intermediate outcome, but that the community residents and the public officials are exposed to the anti-violence messaging, as well as community residents gain self-efficacy to reduce the violence in their communities. Again, leading to community violence. Community is motivated to reduce acts of violence, as well as the community is actively involved in the anti-violence efforts, which the goal would be then to denormalize the violence in those communities as well. And those two areas working in concert would lead to safer and healthier communities as well. And so that's really how the cure violence model works locally, piggyback on that violent interrupter model. Any questions on the cure violence model specifically? Yes.
Thank you. I'm just wondering who implements this? Who does the outreach and who does the work in the community?
DCS.
No.
So they all hear Dr. Box from out of parts there, so you're all of us probably.
Yeah, everybody.
Yeah.
And so that's actually a really good question. And we've seen that implemented in various ways and different sites where that is. Some of it is local government driven, while others is public-private partnerships, and some are just non-profit organizations that are tangentially connected with the local government that is implementing that. What we have not seen is that, a state level approach to a pure violence model or anything like that. It's always the community driven approach, but those relationships really vary. And that really varied throughout the 3 programs that we'll discuss today as well.
Okay, thank you.
I'm sorry.
So basically, you're saying that even like not-for-profits that already have, or already working on trying to better the violence, this would kind of be a platform for them too?
It could be. I know that there's a specific model that Cure Violence uses, and I think that they've worked in the past to integrate those other violence prevention efforts and the interrupters into their program. But I think it's additional training on top of that they help fold those existing programs in.
So yeah, thank you for this. And so just to suggest maybe a possible framework for a statewide approach. I mean, what you're talking about here with this and the next one, I read ahead, so I'm sorry. I couldn't help it. You're talking about peers, right? Peer support. That's the thrust and the power of all of these things is peer support. And we have an emerging framework for the entire state on how to deploy peer support effectively, use economies of scale, use best practices, use all these things. That's really important because it's not only about best practices, there are actually payment mechanisms associated with those things, right? And this is a little bit more upstream, which I really like because I mean, right now we wait until somebody has a diagnosis of an SUD or mental health, and then we say, okay, here's a peer for you. We know that these kids who have all this trauma are statistically very likely, right, to go down that path. And so we'd love to talk more about the notion of like preventative peer work and how we can plug that into our bigger peer framework. So just please, let's talk and
yes.
Does the model include like some kind of wraparound services? Because changing a norm, I think you'd have to really not only look at the behavior, but the factors contributing to the behavior, which would most likely be outside of some of these designs that you have. It would require some kind of, well, I guess intervention is it? So is the intervention the wraparound services?
Depending on the needs of that particular hotspot that they're working in or that community, and they'll connect with the local services and interventions that can help promote those. I don't know that it comes directly from the Cure Violence model with those services as much as they connect to the local services.
I don't know. I just think changing norms is quite, would be an undertaking. Changing community norms.
Correct. And I think even within the models that we've seen within Chicago and St. Louis that we looked at more closely, it focused on the neighborhood level interventions rather than the citywide. And so I think when they dove into the neighborhoods, they were able to connect closer to resources. I think when you move that up a higher level, that gets a little bit more challenging, but not impossible. And I don't think that we had reviewed that as being done at the whole citywide level. It was targeted neighborhood interventions.
No, I think changing norms in a neighborhood can be challenging, but yes, I think it's much easier to do it at a neighborhood level and then rather than a whole citywide, but I just want to make sure that there's services to follow that to help.
So kind of piggybacking off of what she said, I do feel like when it comes to changing norms, it will require like an all hands on deck. So I guess it kind of goes back to my question of, the non-for-profits that probably have been doing, because I know some non-for-profits that I feel like take a different approach. It's really different, but it's very, very, very effective. And when we talk about collaboration, I know that you all have a specific model. Will that hinder the collaboration process?
I guess in theory it could, but I know within the Cure Violence model, they have tried to, especially with that peer intervention and the interrupter at the neighborhood level, they really try to bring in those groups that are doing that existing work, but try to maybe adjust their framework with what they've rolled out nationwide and really around the world now as well in other countries too.
Seems like to your point, it could be a blend of, the neighborhood organizations, and then they would know about additional wraparound services, which is so important. It should be included. A few are in here, but there may be more. One question I had is all of the return on investment data, that was all of this in concert together.
Correct.
And I think that's a key point as a team here, because so often when we look at investments and building out a system, sometimes things get picked off. We do a little of this or a lot of this, or so I think that's interesting. It all is in concert and could be done again at that neighborhood community level.
Yeah, and I do think that one of the big themes that we saw throughout all the programs we reviewed, the 20 and not just the 3, was that none of them were coming in and saying, we want to supplant everything you're doing in your community. It wasn't that we're going to come in from Chicago and tell you what to do in Indianapolis or any place else. It was designed to work within the structures that you already have in place and leverage those. And I think that's important for all the programs we're discussing. Did you have a question?
I was just going to ask you, is Pure Violence an organization?
It is an organization, correct? They are still out of Chicago. I know that they do now have a more global footprint than just the Midwestern United States.
If I could just remind everyone to please use the microphones. We can hear each other in the room, but online it's impossible to hear if you're not speaking right into the mic. Thank you.
Yes.
I'm curious to know, are there any victim-centered components of Cure Violence for the victims, the families of victims who suffer this violence in terms of getting them the help and counseling that they need?
Part of where that comes from in this program are the hospital interventions. And that is where it's becoming more and more, even outside of the Cure Violence model, where they're doing the hospital violence prevention, really focused on the retaliatory piece and the trauma. So when you have a victim of the violence, there's a hospital intervention piece that works with that person and that family to then incorporate that. But that's really more specific at the hospital level. I don't know that they've really backed that up and broadened it to the full program of victimization, but really targeted at the hospital component.
Also, a question about the most serious offenses. So when there are killings, this mentions that there is no threat of punishment. So I'm just wondering, in those cases, could some of these concepts be utilized at the DOC?
Meaning no threat of punishment as in, I think what they're talking about with the post-shooting interventions is coming to the scene of a shooting and working within that community. You clarify the threat of.
I was just reading something from the slide.
Oh, okay. I don't think that they're not going to punish or arrest people for those. I think the intent is to come in after the incident and work right there while tensions are hot.
There's always, every time you have a case, there's always a lot of people milling around. So I think that they're not dealing with any type of diversion program in this. I think it's dealing with the community response with regard to violence and it just being the norm for kids to have guns.
And I think that we see a lot of this that exists already I'm Marion County centric, but seeing that within Marion County, that when there is an incident, there are folks, the interrupters that come out to that scene to work with the community members who try to quell a little bit of that anger and hopefully prevent some of the retaliation and interrupt that cycle of violence that we're seeing. Yes.
Okay, so I noticed that you mentioned can you repeat yourself when you were saying the intervention at the hospital when it comes to like counseling? I want to get an understanding. Are you saying that, okay, say for instance, we have somebody, okay, I use my brother, for example, he was shot probably about a month ago. While in the hospital, your main thing is focusing on healing. You don't want all these different people. You have like sometimes 10 people, you got doctors, nurses, all these people, talking to you about different things when mentally probably still trying to cope with trauma. But I noticed now that he's out of the hospital, it's like that energy is not there. And I feel like it's important. What if this clients, I was just using that example, but what if like we have clients that can't necessarily get the counseling or even want the counseling right there in the hospital? They want to wait till they go home. Is that possible? Or are we working on something like that?
I think within this model that Cure Violence does, that is possible. I know that independent of the Cure Violence, the hospital intervention piece is typically a hospital employee who is trained on doing that and then works with the community programs. And then that person in the hospital will work to connect. Anecdotally off of this, Temple University Hospital has a really good program that they work within the city of Philadelphia on, which they provide that intervention. And then they also do a lot within that same program of gun locks and really trying to wrap around the entirety of it, recognizing, your point that not everybody will want that help right then and there, that some may not want that help at all. But if you can intervene with one or two to help interrupt that cycle, that you continue to push those efforts for it, but then also connecting back to this framework and getting those services afterward, if that individual is still looking for those.
I don't want to belabor the point, but and maybe Julie, this could be some follow-up, but we've heard about these mobile health units, and I just wonder if there's a tie-in to, the victims' families.
Mobile crisis intervention?
Yeah, because there are some of those in certain parts of the state, and I would just see this as a tie-in with those victims' families because they can be very hectic at a hospital. They're just worried about treating the here and now. But I think there's a lot of promise with those mobile crisis units.
In the community paramedicine.
Any other questions on this program? All right, you have another one?
The next program that we took a look at is the Credible Messenger Mentoring for Justice Involved Youth. This program is for youth in the juvenile justice system and is a transformational process which those individuals from similar backgrounds, especially men and women themselves who were system involved, engage the youth in structured and intentional relationships to help work on those attitudes and beliefs and adjustments that can help them positively moving forward. What the youth will benefit from there is that what youth will benefit, the chronically involved in the youth juvenile justice system, disconnected from positive peer supports, beyond the reach of traditional social services, resistant to change, gang involved or involved in violence. And then the credible messengers that help reach those youth come from the same communities, often are formerly incarcerated or formal involvement with the juvenile justice system, and also demonstrate integrity and transformation and are skilled in mentoring youth. This is more of a promising practice more than necessarily evidence-based or proven. However, what we have seen in the 2015 process evaluation showed a 76% drop in gun homicides in California that were associated with this program. And a 2014 evaluation showed that program participants were 1/3 less likely to be rearrested than their counterparts. And that came from the South Bronx neighborhood in New York as well. Are there any questions on this particular program? And I can go a little bit more in depth on sort of the history and the evolution of this program as well.
Where do these programs land? Like who would, I guess it's the same question Terry asked. Like this would be one for like a diversion program or a community correction?
And that was the question that we had throughout this entire process on who would own the implementation and management of these programs. What we found most often was that it was a public-private partnership working with the program who either had city or state support as far as their overall city violence prevention efforts. Is typically where we saw that unfold. So not necessarily housed by one state or local government agency, but more of that partnership in which there is financial support to help implement those programs, but then those programs are implemented by the organization.
This reminds me of this credible messenger. What's been very effective in the judiciary, particularly in veterans courts, or peer supports, where somebody who goes through the veterans courts walks with another veteran, comes and walks through the process with them. And it's been really effective. So it's, whether we look at it with problem solving courts for youth or whether we look at this program and suggest it to the 1359 committee. But I really appreciate the fact you looked at a plethora of programs and said, here's 3 that we think could work in our state. Really appreciate that. And we've got any other questions on the credible messenger? And what you're asking for us is to just say, you've done this research for us. These are the 3. We'd like to see if these can take hold in Indiana, and you're asking for a vote saying.
To recommend these 3
your name
programs
today.
as, yes. And then I won't read through the history and evolution of that program. It's in your slide deck. We don't need to go back through the entire history, but I'm happy to if we have questions.
It's good. That's the next slide.
Next.
So along the lines of Chief Justice, as I was reading the request, there was some language regarding looking for opportunities for funding I just want to understand what this recommendation would mean on the ground in Indiana. Would it be that like on the commission's website, it would say to communities, hey, here are these 3 programs that are endorsed. You should consider them for your county. I'm just curious, like on the ground, what this looks like.
That's exactly what we would be looking at, is having that recommendation say, these are programs that have been looked at and evaluated and are, could work in your communities and for them to take a look at. As far as the funding piece, we're not asking for any funding to be associated with anything. It's more of that identification through maybe some of the other work that's being done. I know there are a lot of federal dollars that are going to be coming through, hopefully soon, for the community violence intervention as well, which would help fund some of these programs. And so really it's just taking that big look, and if there's other funding opportunities through 1359 or some of that other work that's being done, that we're thinking about that community violence intervention and prevention as well when we're talking about the youth justice and juvenile justice reforms.
Chief Justice, if I could follow
Sure.
up. With respect to the funding piece, I mean, if this body decides to endorse these programs, as evidence-based and being positive for communities and for youth, perhaps as grants are being considered, I wonder if through any granting process, whether it be the Supreme Court or any other DCS or whatever, if a favor would be given to programs that have been endorsed by this body as evidence-based and positive, as opposed to if a community wanted to do an unendorsed program for youth. It's just a thought in terms of encouraging use of something meaningful.
So Indiana Criminal Justice Institute, the BJA, there are a number of grants going to be made available to communities for violent crime reduction. And I think if you're a community member, you're thinking, where do I even look? These are ones that we had, and we can just state on the website the process. They looked at these programs. These are 3 that they would recommend. We can't vouch for a guarantee or their efficacy, but at least when you're a probation officer sitting in Wayne County, you don't look at 50 programs and say, which one should, these are ones the Children's Commission looked at, that the subcommittee of the Children's Commission looked at. These were promising.
To that point, Chief Justice Rush, and measuring success, making sure we're really spending our dollars where they drive results. Do you know the federal dollars that are flowing? Will they flow through a state agency, or do they flow straight to the communities?
They
Is that?
vary. There's some that get funneled through Indiana Criminal Justice Institute. There's some, and Justin, where do most of the funds come from? BJA's ones come through, SAMHSA comes through.
Yeah, BJA and ICJI does a lot of youth grants, and I chair that subcommittee, and they're frankly the group not at this table to really hear this conversation, but there's a number of us that are on that board, and that may need to be a note or a letter possibly from the commission or from some of us to their board to say, we ask that you prioritize these if it fits within the federal parameters. And when you score those grants, that you give them more credit, more weight when they come through.
I think the priority is brought forward by the locals. They're aware of all the programs that are currently, and we're just pushing something forward to compare. So when they bring it forward and you're evaluating it on the subcommittee, that's the endorsement. So I think from our perspective, we don't need to send something that says that you should consider this over the other options. I think the mere application, if they're applying for it, they could cite that this is something that the commission discussed, approves of. Some of it is evidence-based, but I don't think we need to suggest to an agency or number of agencies that they should give further weight than what the locals are already bringing, saying this is why it works for my school, my city, my town.
So
Which I think is.
Yeah, so I think, and I have to leave. You're getting Cirillo, so you're getting an upgrade once I leave. So
I can't hear you.
I have to leave, so Cirillo is going to take my place here. But
Okay.
You're getting an upgrade there. So 2 things I think as it relates to the gun safety bill. I think number one, I think we're still unpacking that as a state, and I think this is timely in terms of our process of doing that. Some of it comes to us, some of it comes to DOE.
Yeah.
But I think more importantly, as far as the state's concerned, this is my point earlier, is that when we think about sustainability, these are one-time federal dollars. there are already existing pathways that these things could fit into. And I don't think it's necessarily crystal clear how that would work, but we have to start thinking about that right now because, we give the local, or if the locals get, $5, $10, $15 million that will expire in 2026, it's going to be on the state to figure out how to sustain that. And those pathways already exist, which is why I think that, models are great, but this is all under the umbrella of one concept, and that's peer support. That's peer intervention. That's where we're pushing all of our work, whether it's 988 in crisis or recovery works or criminal justice, because we've seen firsthand the power of peer support. And so as we have these conversations, I think from a sustainability standpoint, we need to keep that in mind. So that's all.
So your recommendation is that we acknowledge on the website that we tasked the subcommittee with looking at these. These are promising programs and,
Consider them.
yes. Any other questions?
The only other thing I would add to that is the value of having some common measurables throughout. So we have talked multiple times about the data bill that you mentioned, which will be so helpful to better understand the picture that we have and how to triage. But the measurables, the common measurables across whatever communities determine to understand what's working is so key. And we're learning a lot of lessons on that right now as we deploy billions in education
Right.
around that.
And I think we have a data committee too. I mean, that we have a subcommittee of this task force that also works on that to make sure we've got some common language in that. Because this is one of our very first Children's Commission meetings, I'd asked the question, what are the educational outcomes for kids that have been in the foster care system? Well, we didn't collect it. Well, now we collect it.
Exactly.
So I think your points are very well taken. Any other questions or comments? You know you're going to get all this, right?
Thank you, Steve. Thank you,
You're doing a
Steve.
great job. You're doing a great job.
One more program to touch on.
You have one more
and then
program. I
it's-
know.
It's a very similar program, and in the interest of time, I won't. belabor
No,
that.
it's the build, right?
What's that?
Is it called build? What is it?
Project Build, correct.
Yes, right.
And really what the goal of Project Build is to work with court and gang involved youth to work on investing in the future, offering individualized as well as community-based programming. Project Build really tries to open doors for at-risk youth, empowering to take charge of their lives, futures, and communities. Some of the key components of Project Build, the intervention components include gang member detachment, conflict mediation, family support services, truancy home visits, peace sports leagues, street violent intervention, community violence response team participation, juvenile justice. Within that, there is a 10-week curriculum. The universe begins with you, the power struggles, bullying prevention, choose right, how to make healthy decisions for life, and then talking about emotional roller coasters and how to handle and address those emotions as well. And some of those key findings from this program, and this again was in Chicago, that 100% of the youth that were connected to a school were promoted to their next grade level. 88% of the youth reduced negative high-risk behavior, including exhibiting aggressive behavior and associating with negative peer groups. 96% of youth who attended a life skills workshop reported increased knowledge of healthy conflict resolution. 33 youth have detached from gangs with intervention assistance in the past year, and that was in 2021. 85% of the youth who have been court involved have avoided recidivating. And then 65% of the youth decreased their use of the legal substances while involved with Project Build as well. So again, this is another peer support and intervention program. And I think that touches a little bit more on the services that you were talking about before and how you can continue to provide those services moving forward as well. Any questions on this
And then
program?
your next slide has the components.
The key components there as well. So again, it looks at the gang member detachment, conflict resolution, family support services and truancy, street violence interruption, and then engaging with youth that are involved in the juvenile justice system as well.
All right, any other questions on any of the three? The cure violence recommendation, the credible messaging, and so two of them are evidence-based and the other one is just labeled promising under those labels. Is that correct?
Correct.
So the next slide has the recommendation for resolution of support. And you're asking the commission on approving this as to endorse. And I think what I'm hearing today, we're more comfortable saying, recommend, that we're looking at this, that recommend, and maybe have a little bit more information, recommend based on the extensive work of the subcommittee that looked at these programs, the Cure Violence Credible Message for Justice and the Project Build. We also asked the commission to consider potential funding opportunities for these. And that would be the recommendation. So I'm slightly modifying your recommendation. We're recommending, and then we're saying the source of the recommendation, that we had this task force work on that and look at dozens of programs, and then also consider potential funding opportunities. And I'm just thinking of some in my own head with regard to the judiciary and probation on that. So that would be the, I guess I'd make that motion that the commission, and then we'll have some, with the motion, then we'll get some questions. Recommend that these, the Cure Violence Credible Message for Justice Involved Youth and Project Build program initiatives based on the recommendation of this specific task force, having reviewed multiple programs and thinking these were the best fits for Indiana. And then that we would also consider potential funding opportunities within our different areas for these programs and initiatives. There's a lot of motion and a little sketchy in the middle, but any questions or any addition or other motion, Brandon?
I do have a comment maybe. Is it possible to add some language about encouraging cross-system or community collaborations as an officer who has tried to combat some of these things in a community? Sometimes it's difficult because of the severity of the offenses or because of competing interests, so to speak. So anything that I think this group could do to encourage that, even just by language or by funding, would be helpful.
To add a sentence that, I don't know, how would you word that? I mean, inherent in this is just as we're all sitting around this, you today come from different systems. I think it's inherent in this. I'd be happy to add the language.
Yeah, I'm not certain. Anything to promote community collaboration or cross-system collaboration might be helpful.
Any other additions or questions?
One
Chris?
thing I didn't hear about, and maybe it's inherent in the process, but, life skills in using social media, because so much violence can be incited through that, especially with teenagers. And I don't know if it's part of these programs, but boy, and maybe that's a whole separate project, but helping children navigate, the challenges and what that can lead to. So.
And I don't know if that's a specific part of that programming, but I imagine that if that's a issue that's being driven in those neighborhoods or those communities.
Yeah,
that
it's
would
just focused on
be
implementing
incorporated.
activities that reduce participation in violence and crime. I mean, just recommend that we look for funding. So within, it might be legislatively, you may decide you want to or not. It's just a recommendation that I would say, I will look at the funding I have available or grants have available, talk to the juvenile justice, and if we're able to fund and promote and.
So as they're looking to adopt these programs, then it's incumbent on them to find funding.
We can assist them. And I don't know whether like, JRAC funding, I don't know, the JRAC funding, would that cover any Justice Reinvestment Advisory Council funding? Would that be in the parameters of?
It might. I'd look to folks who sit on that, and I'll go back again to the ICJI Youth Subcommittee meeting. If the Children's Commission won't, put together a letter or something, I think that's perfectly fine, but I'll certainly do it for them, because I'll tell you, we turned back a lot of money because the locals didn't know what programs to put in. They didn't know what to submit or how to prioritize things. And we just turned back a lot, and we give a lot of money to pre-existing programs as opposed to new ones. So I love these new ideas, and I'll certainly share them with our subcommittee staff to see if there's a way to at least market them and advertise them through those grant applications and endorsements.
We would say encourage the request of funding.
Right.
Yep. Ms. Rodriguez, you had put your hand up.
So basically, if this goes through and is approved on our commission today, DCS or anybody that deals with children, any not-for-profit can go on the commission's website or Indiana's website and look at these programs and decide which one that they would like to implement? Okay.
That was we didn't want to usurp anything that was being done locally or push anything on anybody. We just wanted to make sure that if we're looking for programs, that there were programs that had been looked at, evaluated, and then recommended.
You know, and then the next slide, the final slide is the thank you. It shows all the subcommittee members, and it was a great cross system. You had academics, you had field people, you had, you know, prosecutors, public defenders, mental health. You know, nice, was an active committee, it looks like.
Yes.
Any other questions? Sure.
Thank you. I would like to know where in Chicago is these programs being held? Is it with the Cook County Juvenile Probation Department? Is it with what?
I don't know that I have that specific answer off the top of my head. It's a community based in Chicago.
It's not
Directly
citywide.
connected with the system.
Pardon me?
It's not directly connected with any system within Chicago. It's just a community organization
So
within
it's
Chicago.
done by organizations, community-based organizations on different parts of the city?
Correct, yeah, they have, I'm sorry,
You know what part of the city, where?
I don't, but I can get that information.
I would
for
like
you.
to know.
Yeah, we can get that.
Yeah, I would like to know. Thank you.
Yep.
Any other questions?
Can you restate your motion?
Not really, but I'll try. That the commission approving the status of children in Indiana, there's a typo on that slide, that we recommend these three programs, Cure Violence, Credible Message for Justice Involved Youth, and Project Build, as programs that have been vetted through the subcommittee. We received information that have been vetted. We recommend these programs as presented to us and vetted through this subcommittee. And that we also will consider potential funding opportunities for those programs and initiatives.
One question, suggestion, recommend or endorse? Because to some extent, it sounds like what we're doing is we're endorsing the use of these programs as evidence-based for local communities. I'm okay either way. I don't have a strong.
I want one,
opinion.
I would even go one step down from the recommend or endorse or support or we're not, yeah, we're getting a half-hour presentation on something that acknowledge that these programs have been, I think acknowledge would might be better. Yes.
Well, then I guess I have a question. Do we need to vet them more because we've only had a short time to?
Well, I think what we did is we had a close to 20-person committee.
That did-
That did the vetting.
Oh, okay.
That did the vetting. So, and that part of what we do in the Children's Commission is we pull in content experts to come tell us things
That they've done.
that are smarter than us in these areas. So they have vetted these programs. They looked at 30. How long were we working on this?
I think it was about a year and a half.
So they looked at 30 programs, they studied this, they know the landscape in Indiana, so we're trusting their judgment with regard to, and maybe we need to say support as opposed to just acknowledge. Acknowledge is like, I'm acknowledging you're up there right now. And you'll probably still be up there a while because we're still working on the motion. I think support. I think if we look at the people, take a long look at the people that were on this committee on the slide. I mean, they all come from many of our agencies. Are you comfortable with that?
Yes, ma'am.
All right.
Second.
All right. Any other discussion? All those in favor of supporting these recommendations that have come through, and I'd almost want to I'd add in the motion that it came after an 18-month study by these commission members as these being effective programs for us to look at in Indiana. All right. All those in favor say aye. Aye. Opposed? All right. Thank you.
Thank
Well
you.
done. Thank you all. I know that's tough doing it this way, but I don't think there's a way that we can do a deeper dive.
So
All right.
somehow we'll piece that together from the recording.
Right. The other, Nancy and Stephen, please send our thank you. That's a job. That's a lot. Did they come and do presentations to you? Okay.
So Cure Minds, they present to us, they were one of 2 or 3 in the process.
Okay.
Others were evaluated. Where we could get communication with the organization, we did. Some were more just the information was there, the studies were there.
All right, thank you. All right, next up on the agenda, we were asked we're going to postpone number 5, mental health and substance abuse, the presentation by Dr. Halvershorn. We'll be having that at a later moment. I do have a handout for you on the mental health summit. We'll be passing that around. You will be invited. We now have all counties but one, and I think we're close to getting that county. Every county is bringing a team to the mental health summit. It's October 21st. The agenda for the summit is on that. Speaker Houston, President Pro Tem Bray, Lieutenant Governor Crouch, and myself will be bringing a national speaker. There's breakout groups. The whole plan on the mental health summit, you'll see that the partners is really to answer the question, who do you call? So somewhere to call, someone to respond, and somewhere to go. Using the model of the local JRAC teams that were enacted by legislation last year. That's the Justice Reinvestment Advisory Council. We had a statewide team. Every community is ordered to have a local team. And we're really looking at the mental health, particularly justice involved youth and adults. The number of cases of mental health coming to the courts have just exploded. We did district meetings. We go around and talk to the judges. The judges say the number one issue that they're having are mental health. Upwards of 70% of individuals in our local jails have mental health issues. Every time you look at the paper and there's some type of shooting, there's some type of mental health crisis going on. So how do we all come together cross system? So here's what we're doing. We've got I put the agenda there, the speakers. We're limited. We're sort of scraping together money to fund this, but we're going to get it. It's funded. We now have, I think we have about 1,000 people coming from all the community, the teams from all the communities. We're inviting some legislators that work with us that are interested in coming. There's a registration. There's a website there where you can go and then you can see what is on the agenda. And the teams will be going back. The sequential intercept model, for those of you to know, we're premising it on that from that first crisis call through, now it was 911. We're hoping we help build on the 988 to going to jail. What do you do? And how do we divert people with serious mental illness from courts? Things on competency restoration. We have a lot of people in local jails for quite a period of time. They're incompetent to stand trial and they're waiting to get an evaluation. These are big numbers. So the children and families, we're looking at mental health, certified community mental health centers, trauma-informed care, mental health crisis, peer support is a part. So different people from your team can do different paths. We have Judge Leifman, keynote presentation on the definition of insanity. And it's not really insanity. The insanity is the way we've been dealing with our mental health individuals. Have you, Dan, have you ever heard Dr. Leifman speak? Yeah.
No.
Okay. He really is excellent. So the judiciary realizes that because we have become a primary referral source to getting people to treatment, our judges have to do better. Our system partners have to do better. And the great thing about, I tell our judges, when you call your local people to come to a summit, they show up. I don't know what it is about our jobs that people say yes. But I'm thrilled about this, that this is going to be decade. By the time we roll out a system like we did for 911, where you pay a little extra on your cell phone bill, this is going to be we're going to see it's going to take decades, but we've got to start doing this now. And I'm thrilled about this many people from every corner of the state coming together. So, and I'm excited that I've got the leadership from the legislature and Doug Hunsinger, the drug czar. He's been an outstanding partner with this, Lieutenant Crouch. This is a project. This is a passion for her as well. So looking forward to it. And then you can look at many of you are listed as the partners that are doing this with us. So any questions on the summit? I mean, I think it's just a tip off on this.
I have the registration link that I'll be emailing to the commission members later today.
All right. That's all I had on that. And what's interesting about the teams and the communities, we only have, I can't remember the size of the teams, but people's like, can we bring more team members? So we're just I'm looking for some funding. If they want to come and they want to get trained on this, I want to. So we have a wait list. Do you know what the wait list is? How long? Yeah. All right. Anything I left out? All right. Yeah, you're going to say yeah. All right, Julie, Executive Director update.
Okay, so this is going to be a new kind of recurring feature at your meetings, which is implementation updates. You'll recall that the intern that was working with me last year, Jamie Smith, put together a great long list of every action the commission has ever taken in its 9 years of existence. And my mission now is to follow up on those and see what happened. Has this thing been implemented? Is anybody using it? What's going on? So we're kind of going to try to bring back one or two things at each meeting that have been passed before, and kind of give you an update. If I have that information, I will bring it. If I don't, I may be asking you all, do you know if anything has happened with this? So and actually that's not the case necessarily with 1359 because that's a currently happening thing. So I'll give you that update, but what I just said applies to numbers 2 and 3 under my updates. But on HA 1359, the Youth Justice Oversight Committee, just a kind of a quick procedural update. Chief Justice Rush mentioned it at the beginning, that Youth Justice Oversight Committee has been formed. They've met twice now. They're really digging into all the different elements that were in that bill, which is a lot, as you mentioned, and I've presented them here before. They have formed 6 work groups with sort of a 7th as an asterisk to work on all the different elements. So there's a work group on data. There's one on screening and assessment. There's one on diversion, which was our diversion group that presented to you all a few months ago. They're continuing. There's one on reintegration, also came out of this commission, was already existing. There's one on behavioral health, which has the small task of coming up with a behavioral health plan for justice involved youth for the whole state. And I'm missing one. Grants. Thank you. Grants process. So how to fund some of these different efforts that are contemplated in 1359. And the 7th with an asterisk is not technically under the Oversight Committee, it's under the Judicial Conference, but there's a group that's looking at developing juvenile specific probation standards. So all those groups have formed, they've all met at least once, they're kind of ready to go. Many of them have scheduled out their meetings to the end of the year and they're digging in. So that's the update on 1359. The next meeting of that Oversight Committee will be in October. I think we're doing the 2nd Wednesdays of the same months that the commission meets. So you all typically meet on the 3rd Wednesday, and those the Youth Justice Oversight Committee is meeting on 2nd Wednesdays. So October, December, February.
Done. It's term limited. What's the end of that?
Well, all of the kind of final products are due June 30th. The grants plan is due sooner because I think there's an intent to get that into the budget in the upcoming session. And everything else that's being developed, the data plan, the behavioral health plan, all the different things are basically due July 1. So that work is going to be going on during this current fiscal year. It's like breakneck speed, but we have all the right people at the table, really people from all over the state, from every, small counties, large counties, all the systems. And they're really looking at what works for kids and what works for our communities and how do we do something better than what we've been doing. Acknowledging everybody's been doing as best as they can, but what else can we be doing and how can we be a little bit more consistent across the state? Any questions on that effort? And then so number 2 and number 3 up there, and there's actually 3 different sort of products that you have linked in your agenda or they're linked on the website. And these are all things that the commission has already done, that has already passed, endorsed, whatever word you used at the time. And I just wanted to bring them back again to your attention because we have this ongoing question of, well, what does it matter? What does it mean, right? When the commission endorses something, does anything happen after that? So I want to say it was about 4 years ago, you all endorsed this guide on reducing the use of seclusion and restraint in facilities that care for children. And it was just kind of a model. It was, some advice, some guidance with some example policies in it. So that's on our website. It's there, it's available. I I think some of the residential facilities that, that DCS uses were involved in crafting that guidance. Hopefully, some of the others have looked at it and read it. I think I heard recently that DOC is in the process of updating the standards for detention centers. I don't know if it might be useful in that context. So again, just kind of wanted to bring it back to everyone's awareness that that tool is there, that another subcommittee in another time put a lot of work into kind of pulling that information together. On the next one, the positive discipline guide, that was a great product that came out of DOE that our education committee, our education task force looked at, as well as our equity committee. And, you know, as this particular recommendation, the positive discipline and the information sharing guide, both of those were requested to be more broadly promoted by the group that was looking at educational outcomes of foster youth. So when they're looking at, you know, we have kids in foster care who are suspended at 2 or 3 times the rate of non-foster care kids. We need more resources in our classrooms for positive discipline and knowing how to handle kids with trauma, right? And we have this fantastic tool. So can we get that out more to the field? Can we try to make sure schools have that and are aware of it? And then the information sharing guide, same thing. So people know that they can be sharing information with each other if they're working with the same child, and how best to do that. So again, all of those are just kind of reminders. Those tools are there. They're on the website on the tools and resources page. They're also linked from your agenda today. So anything that anyone can do to keep kind of getting the word out about the work that's been done by our past subcommittees, and that can still continue to be useful, hopefully, for people in these fields. Any questions on those? And then my last update is just the evaluation is ongoing, as you all know. If you are a legislator or know a legislator, maybe a little nudge to complete the survey. And I know, you know, 150 legislators don't all know or have an investment in the Children's Commission. Obviously, those of you here do. That's the survey that's in the field now that is so far has a pretty small response. So we'd love to know more about what legislators, if they're even aware that the commission exists, if they think it's doing anything useful, if they think it could be more useful in different ways, we'd like to have that information.
Is that the 99-page survey?
It's not. But there is an option to.
There's 99 pages.
I think they're trying to get in touch with you to interview.
Yeah,
you.
I know.
Yeah, that's an option. It's also an option. There's an email in there.
I
you
guess
can say, I don't have
me
time to do the
saying
survey.
that,
Yeah.
you know, I may be being funny, but legislators are not going to fill out, I don't care who they are, a survey that long. They're just, I got into it and then I said, oh, this isn't over yet?
I don't know if that's the same
I know
survey.
you
It's
need it,
not that
I
long.
understand, but it's too long. It is absolutely too long. Okay, I just found mine, closes on August 26th. It's long.
Well, give it a try. Or you can email the research team and they will gladly do a phone call with you if that's easier. Also, all of the surveys that have been out will close at the end of this week. And then we'll by the next meeting, we should have some data to present to you and kind of some early findings around what we're finding about the commission's impact and recommendations.
I had Kayla send it out to everybody, so hopefully they got it.
Great.
She's out this week.
Thank you. Thank you for doing that.
Okay, I'll send it out again.
I don't think anybody around this room will like surveys. I will say,
I know.
I'm very protective of my judges because they want me to send out to the judges all the time.
Yeah,
I get it.
yeah.
All right, anything else, Julie?
That's all I've got.
All right, so what is left on the agenda?
Commission members.
Any
report outs.
priorities? I mean, just one thing we used to have time for, but we haven't had time for in years, is just anything with regard to children, any priorities, anything based on your area that you would like the commission to look at, research, assigned to a task force.
The mother or the infant mortality. I would really like, I'm sorry.
Would you like some information on the infant mortality rate?
Yes, I would really, especially, so now I work at a daycare and I'm surrounded by these kids all day. And more importantly, their mothers, and just the stories, you know, you hear from the mothers. I recently had a friend who was a ward of the state. Her 3-week-old passed away, and there's just not. I feel like it should be prioritized way more. I genuinely feel
Infants or mothers?
both.
Dr. Vox, we had some presentations years ago from your agency on mortality. Maybe it'd be nice to compare. 'Cause what do the numbers say? They say it's improving
So
slightly.
it is. The
Okay.
unfortunate thing, well, in 2019, we had the lowest infant mortality rate we've ever had in the state of Indiana, 6.5 infant deaths per 1,000 live births. Unfortunately, it ticked up to 6.6 in 2020. And the big increase there was in our non-Hispanic Black infant mortality rate, which in the 3 years prior to that had gone down by 30%. But if you look at when I started in 2017, we had the 8th highest infant mortality rate in the nation. Based on data that we could compare to other states, the 2020 data, not every state has out there. But in 2019, we had moved to 14th highest. And our Black infant mortality rate had gone from 3rd highest to I'm blanking, but it 15th or something, 18th. So there's definitely been improvement. And I've been giving some of this data to the legislators because the legislators have been investing in infant mortality. And so I could try to put something together that, you could have a sheet. But it's still not great. We have still, our Black infant mortality rate in the state of Indiana is 2.4 times our non-Hispanic white infant mortality rate. And that's despite a lot of amazing work that has been done in and by our Black population within their communities. And I can go over all the different programs that we're doing to address that. And when it comes to maternal mortality, we do have a disparity that for the first time, we've been collecting data 18, 19, and now 20 data is out. For the first time, our data showed the disparity. Before that, the non-Hispanic white infant mortality rate was higher, maternal mortality rate. And that is probably related to the fact our small numbers, about 60 to 65 maternal deaths a year. So we can present it officially.
Yeah, you did it. I think you've done 2 or 3 presentations for us, haven't you? Maybe 2, and they've been very effective.
Yeah, it's
So
been a while,
yes,
but
I think
don't
that's
want more people to say stuff, so whatever you want.
Yes, circling back on that. We'll kind of go around this way. Anybody, Senator Bro, anything you'd like to?
Senator Bro, use the microphone, please.
I'm sorry. Given the September 15th deadline of the new health ruling that says abortions are banned entirely, is there any way we could maybe do some kind of, there has not been any real discussion of expanding the understanding of health, anatomically correct health issues in our schools to help reduce the number of young people that could potentially become pregnant and not have any avenues. I know that's
that's a big subject. What do the school, what are they doing now?
I would encourage us to have even a separate presentation because it's probably just like we heard, varying programs depending on the school right now.
So as far as what is available for teenagers with regard to this issue, it's good. That's Senator Bro, I think, yes. I think getting that information would be informative.
Well, and then we can help maybe disseminate it out.
Right.
So we can get it into the schools or to where it needs to be.
Right. And it ties also to the maternal and infant mortality too.
Yeah, absolutely.
Yeah, there is a lot of great programming and information out there that would be available to schools to implement, and we would be glad to help with that. It is a very individual school decision, superintendent, principal related decision. And so there are some schools that engage very actively on that and other schools that don't want that.
So we may have a working group look at this with regard to the same type of recommendation we have now, recommendations. Schools probably don't, this is gonna be a lot on them. Where do they look? What are the programs? But maybe we can add that to that. Aren't you glad you're here today, Dr. Box? We can add that too. Because I think it's a preventative piece on this. I think it's a preventative piece on that.
Chief Justice, at our last meeting, correct me if I'm wrong, Julie, we did see data in high schools of how many kids were sexually active, et cetera. So maybe
Risk
just,
behavior survey.
yeah, revisiting that a bit, because we did bring up this question of what are schools doing and how can we be supportive of increasing education as a preventive for including unplanned pregnancies.
Ms. Rodriguez.
And then even thinking about, I don't know if this statistic is still true. I'm pretty sure you guys would like can enlighten me if it's incorrect, but I think there was like 7 out of 10 women or teenagers in foster care got pregnant. And it's just making me think about what about the ones that are probably in residential or don't have access to the school system itself? How would these children still get this information that I feel like they need?
Yeah, and Julie, we're taking notes. We'll take notes on this and then we'll kind of figure out what committee and what. So this is just sort of a sharing, just a sort of a community sharing, but great points, great points.
If I can interrupt you. So Julie and I, after that last commission meeting, Julie and I met with some of those focus groups of those folks that have been working on it. So we've been meeting and we're trying to work with the DOE a little bit, and we'd like to create some type of curriculum or documentary that we can actually videotape kids having a discussion, right? Because parents sometimes don't have a discussion. But if we can do a very impactful video or documentary of somebody having a child way before they're ready, right? Or maybe a discussion of kids talking about this and the effects of what that could happen. So we really want to we're trying to get some federal funding or any kind of funding. And I know there was some rescue funds that might have been available, but I think they might be spent already. So if anybody's got any kind of, and I know Dr. Box, we talked earlier, that she may have some tools in her.
I feel like that
toolbox
there, I don't know this for sure, but I'm sure that that type of video exists, that type of
Yeah.
information. I don't know that we need to recreate the wheel, and I'm
Right.
sure that it's probably available for free. So give me just a little time to research.
Yeah, I remember.
Tomorrow
listening-
morning.
All right. so
I got a
we'll go
great
around.
team
So
behind me,
I
so.
want to make sure everyone has a chance and then we'll do it. Dr. Resnick, anything?
Yeah, I don't have anything in per se that we need to engage committee with, but happy to present on certainly the work that Jay's doing, particularly around pediatric mental health. So the partnership with Riley and how we're hoping to expand access points for mental health by really moving some of that into the primary care or pediatrician's office. So I think that the Be Happy Healthline and how do we do more peer-to-peer consultants? Because part of the issues for primary care providers around caring for kids with behavioral health and severe emotional disturbance is going to be that they just don't have a lot of experience. If you're in a rural area, you may not have seen enough kids to feel comfortable with how do I make a diagnosis? How do I make the appropriate treatment? So those are a couple areas in the mental health sector that we're investing in. And certainly I think at point could come back and present on that. In addition, work that we're doing already in Medicaid, as folks know, waiting from CMS to get approval of our 12-month continuous coverage. And then really thinking about the end of the public health emergency for us as an agency and Medicaid. How do we do that in a way that doesn't result in individuals losing coverage who then just have to get right back on and get coverage again. So.
Excellent, thank you. Chris?
Honestly, I'm really looking forward to the outcomes of all these work groups for 1359. I think it's going to be great to see, what comes out of this and the recommendations. We have, as an agency for the Department of Correction, we have 3 out of the 6 work groups. I think we have co-chairs on there, and then we have representation on all of the other ones. So again, I'm just really looking forward to the outcome on what's going to happen with that.
Thank you. Bernice?
No update at this time. Thank you.
All right. Representative Jackson, I know you're here from the Oversight Committee. Anything you want to let us know?
No.
All right, thank you. We continue to, we have a lot of children committees. We've got Nancy was here from JDAI. We're chairing it. The CASA program, the mental health. So children and families kind of permeate a lot of our sort of forward-facing work that the courts do and will continue to do. Probation in Indiana is under the court, so working with our juvenile probation officers is a key part of our constitutional responsibilities. Representative Bond?
Just to a point of reference or information, I was working with Congressman Walorski, and we were trying to work with the kinship care federal funding. And so it's kind of been put on hold, as you know, she's left us here a few weeks ago. And so we'll try to reengage with some other Congress people that can help us with that issue, especially when it comes to the kinship care and the licensing parcel that works with the federal aid.
We have legalhelp.org too, with any of your kind of constituents, is you can go on if you need guardianship forms, things for expungement. There's a lot of free legal help available at legalhelp.org. So for your constituents, a lot of the issues we see in court are the issues your people call you about, right? I've got my raising my grandkids. I need to get this expunged. I'm having housing issues. So we have put together pretty robust self-help forms at that website. So a lot of issues involving families on that.
And then lastly, just we're having our summer study dealing with our field review teams and DCS and in the Department of Health, and trying to look at where we've been and what we can do differently or better as we move forward. Been trying to get some information from other states, but it's been very difficult as well. The data is always good when you can get it.
Thank you, Representative Vaughn.
Chief Justice Rush, one
Yes.
quick question, just on what
Sure.
you had said on legal help. Does that also have information on there, we can talk afterwards, on individuals who need help with housing and landlords?
Yes, it has eviction help. And plus we also have another service that's available for people that need, there's really robust services available for people that need help with housing.
That was from my other job.
Thank you. Since we last met, DCS got our prevention plan approved for the Family First Prevention Services Act, which was, I'm looking at David over there. It was a lot of work. We submitted it in March of last year. The reason it took so long is probably because I'm a little stubborn, but we dug in our heels because we really, really wanted to get a prevention plan approved that went more upstream. And we were actually the first state to get a well-supported program, Healthy Families America for Healthy Families Indiana, approved in the way that it's approved for, which means we can serve more families and get federal reimbursement for it. So pioneers in that way, Indiana once again, leading the way. So very proud of that. I would say the one thing that I think we'd be happy to talk about is our Indiana Family Prevention Indiana Family Preservation Services. That is a program that we started here to do what we could to prevent removal of children from homes unnecessarily. What can we do to keep children safe at home with their families? And so we have some really good results so far from that. So we would be excited to share that. And we are evaluating that to see if it can get approved by the clearinghouse for 4E funding as well. So.
And then you're also looking at getting a standard for family recovery courts. Is that in the works?
Yeah, so Don and I believe David also are looking into what that would look like and what that would mean.
We have expanded family recovery courts when we're able to safely leave children with their parents as they're going through recovery. Outcomes have been fantastic. We're just trying to get DCS to give us, we're just lacking. We've lost, the governor's office kindly gave us $1 million a year to start that. And that's going to be ending. So we need more funding for family recovery courts. Representative Summers.
I have two things. Piggybacking on Senator Bro and with the total ban, I believe that we're probably going to have an influx of issues in DCS or, any of the areas. So anything that we could do now to be ready, I think that we should think about. I think we should plan ahead, because I think that there will be, because unwanted pregnancies are going to leave unwanted children. And with unwanted children, that means that they're going to fall back on the system. And with our system as it is now, I think that we need to have a future look on how we would help and how we would accept, or do we think that it would swell? I'm going to say yes, I think it would swell. Second thing is, you were talking about infant and maternal mortality. Dr. Box, this is your invitation. On October the 4th, I've been giving
an opportunity through the Health Committee on Summer Study to look into maternal mortality in Indiana. I just got that yesterday, so I get to do a presentation on that, and that's what I'll be doing on October 4th through the Health Committee.
What time and where? What time and where on October?
I
4th?
don't know. I'll get back with you.
Justin?
I think I'd echo Chris's comments about 1359, man. We have a lot of our staff invested in that, a lot of the judicial officers participating in that. We're looking forward to seeing how that kind of shakes up or presents options for us to change how we do business. The specific thing that may be useful for this commission to hear, not right away, but down the road is some of the outcomes from the upstream pilot. Those are really starting to move along in LaPorte and Tippecanoe County. That's a child welfare prevention intervention program that we've been selected as a national pilot for. I've been texting with Mary Kay and having those judges come in and talk about some of the outcomes and what they're learning. I think it'd be useful in the future.
Zach?
I'll just say, the budget agency, we're in the middle of budget development right now.
I was trying to help you out.
Thank
My best friend.
No, I'll just mention that we are right now at the budget agency in the midst of budget development. Statutorily, those were due September, are due September 1st. Our internal deadline was August 22nd. I would say, I think it might help to some extent that, to the extent maybe this body has ideas that we might want to consider for budget development. We will start presenting the governor's recommended budget to budget committee probably sometime in early December, or at least that's when agency hearings will be, and then we'll present the budget probably around January 4th or January 5th. And I think, support for our agency programs, whether it be that benefit children, whether it be DCS or FSSA or Department of Health would be helpful.
Dr. Box?
I'm just excited about some of the findings around children and schools and working with Dr. Jenner and her team at the Department of Health with regards to increasing or improving our school nurse to student ratio, getting some of the emergency medicines like albuterol for asthma attacks, epinephrine for severe allergic reactions, naloxone for overdoses in the schools, making sure that those statutorily required screenings for visual and hearing screenings, which some children, that's the only time that screening gets
Right.
done, is it's going to make sure that those are getting accomplished. And then really working, we talked about education for reproductive health, but also obesity and nutrition and some of those other really important things that we've maybe cut out of schools, but really that's the time when we can reach kids and families about it. So we're excited to be working on that.
Excellent. Chris?
Thank you, Chief Justice. We're excited to be participating in the 1359. We have a staff attorney participating, at least a couple of prosecutors. So we're excited about that process. We've got some training that we have coming up. We are doing a webinar on children and guns and what the new gun law changes mean and how can we better get services to communities. And so, there'll be some changes. So we're focused on that. We have a summit coming up training, help to train officers on these drug dealing resulting in death cases with the fatal overdoses. It's still a relatively new statute, but those can be complicated cases. And then we're gearing up for our winter conference, which we have 91 elected prosecutors who will be starting new terms in January. So this is our largest conference every 4-year cycle. So those are our priorities.
Brandon?
Thank you. I think from a probation perspective, I think of it as 1359 having significant impacts, but looking at it from a capacity standpoint for those counties that are JDAI sites, but also those counties that aren't. So what can we in the field of probation do to support the counties that aren't JDAI, help coach them up? Many of the things under 1359, I think JDAI sites are doing, but also what as a JDAI site can we do better or expand into? And then just overall, I think we're fortunate in probation. We don't face a lot of attrition. I think probation officers generally stay. But as we look at the ever-changing field of probation, what can we do to continue to train and retain the staff that we have?
Thank you, Fran. Dr. Jenner.
So related to today and more broadly, my mind keeps going back to this chart here where it lists the students by age. And my mind kept going to, and I even whispered at one time to say, I wonder how many of these students were enrolled and attending school at the time of the offense versus who had dropped out. So that goes back even further to these students and the identification of these students compared with the data that we have at the Department of Education, which is at the end of third grade, could these children read? Because if they couldn't read, if they can't read, then they then struggle to learn, and therefore we see increased behaviors happening in the classroom. And so my mind was going to the 1359 opportunity, and just, I wonder if the data team would consider how quickly we might be able to even run some of those numbers based on what we know today. What percentage of these students pass iRead? We have 10 years of data on that, so we could probably pull that number. And then how many were enrolled at the time of offense? We probably could pull that number as well with a sample size. So I think that could be really telling, again, on how we can proactively.
That's a great idea. I wonder if we merge our data, our court data with regard to offenses and your data with regard to the iRead and graduation.
Yeah, I mean,
and attendance.
we have, well, jump in.
Yeah, no, I just met with one of my schools and they talked about the absentee level in the K through 3.
Yes.
As just huge. And if they can't get them reading by the 3rd grade and they're not coming to school and they can't get them to school to get them in there.
It is so true and it's so real. Our most recent data as a state shows that 1 in 5 children are leaving 3rd grade not able to read post the COVID pandemic. It is about a 20% difference when we look at our students in poverty, our Black students, our Hispanic students. We have a level of urgency. And in fact, last week, you may have seen Lilly Endowment invested. We're investing 111, up to 111 million in the state to work with our K-3 teachers to make sure they know the most recent, brain strategies to teach reading. And then today we have an announcement, a press conference yet today. My comms team always fusses at me for getting in front of the announcement, so I'll whisper it to y'all after. But today we're announcing supports for parents and families who maybe couldn't afford tutoring, if not for some support. So a lot of things happening, but the power of connecting this data could really show us how we can better triage.
You get, DCS gets the children before the courts get the children on delinquency. So are you linked up? Like, if we link up our juveniles with regard to that data, DCS needs to get linked up so that your case managers know that this child.
Yeah, I mean, there are a number of research questions we could probably determine. And maybe it's worth, whether it's a subcommittee or several, us pull some of our team members and, but
The committee has somebody from all our agencies. on it.
Yeah.
We can say that we want to ask them to start looking at it. If we need a grant, if we need grants, or Zach said he just offered money, wasn't he just offering? money?
and you know what, conveniently, I have a meeting with him later today, so perfect, add it to our list.
But I'm just saying, if we can link that, that's such a preventative piece for your people to know immediately, for probation on the courts to know with regard to the educational deficit.
Yeah.
So we can work them into dispositional degrees.
We have to, right?
Yeah.
So, and
But
that's
then we've
such an
gotta find evidence
opportunity.
that- I mean, what do we wrap around this child once they come into the system? Because everyone you're struggling with, we've touched or are going to touch.
Yeah. The other data that will give you code chills, I think, is this year we piloted iRead 3 in 2nd grade for schools who wanted to take it to see if children are on track. And what we found from that data, actually William Durham, who serves on the State Board of Ed and is executive director of 100 Black Men, asked this question. He said, what is we know 47% of the students passed, incredible, could read at second grade. 15% were on track. The remainder were already behind in second grade. And that student population gap that I described with low income and Black students and Hispanic students and EL students was already there in second grade. Like it gives me cold chills, and it's an urgency, and it's also a huge opportunity that we can solve. We can.
Do we have any, it makes me think about these children that maybe aren't making it to school or can't read. How much support at home are they getting? And do we have anything to support parents? Because what if the parents don't necessarily know? What if the parent, do we have anything to look at the history? Because, you know, we all know that if sometimes these kids are first generation graduations, and it's hard to try to get something from a parent that they can't really give you. They, you know, sometimes the kids go home with homework and the parents like, well, I don't know how to do this. You know, we didn't learn this back then. I know you said tutoring. I feel like that would be a really, really a really big help, you know, but also engaging the parents, because we want them to realize at the end of the day, these are y'all kids and we are here to assist, you know, in any way that we can. But at the end of the day, these are y'all babies, you know, and
Wonderful points. Yeah.
I might use your example in the press conference today. It sets it up beautifully. I'm like dying to just say it, but anyway.
These are
Yeah,
young.
well, thank you all. I think that gives us some ideas on looking at future topics and working together. And I kind of like these I can't do it very often, but I like these report out. So,
Thank you.
all right, we're adjourned. Thank you. Thank you.
Dr.
Okay. Yeah, the biggest challenge, this was a piece of it, I think my emphasis of this is here. From individuals coming all the time.